Hello, this is Professor Marvel. This is the week 3 concept recording. During this week, we're going to be covering migrant farm workers, rural populations, homelessness, and poverty. All of your readings from this week are in your Canvas modules. They're embedded in your uh, week 3 modules. So I'm going to be going back and forth between our week 3 PowerPoint and our reading modules. Okay, so I'm going to share my screen. And this is the PowerPoint we're using. Okay, so again, the concepts to be covered: migrant farm workers, rural populations, homelessness, and poverty. Let's start with the migrant population. Here's some questions to ask or to think about as you're doing your readings. Who are the rural migratory and seasonal agricultural workers? Common health concerns specific to the migrant farm worker? And what are some barriers preventing the migrant farm workers from receiving health care and coverage? So let's go into your uh, first reading in your module, the migrant farm workers. Who are they? There's a lot of history here in the beginning of your reading. About statistics and history about the migrant farm workers. I want to review a couple of things. What are some common health concerns specific to migrant farm workers and their families? And here's a list of common concerns: heat-related illnesses, exposure to a variety of pesticides and toxic chemicals, injuries, injuries resulting from using equipment, as well as hand tools. There's also an increased risk for urinary tract infections and other infections, bites from animals, higher susceptibility to infectious diseases. And then with migrant farm workers, there's also a high incidence of mental health issues, including depression. Okay. And that's typically caused by the cumulative effect of their constant relocation, living in poverty, and stress. Okay. Um, what are some barriers that prevent rural and migrant farm workers from receiving health care? Okay, there's a lot of barriers for migrant farm workers. Okay, they face numerous challenges when they're trying to seek health care or trying to find affordable coverage. And here's a list of them. You can read through these bullets. And one of the issues with migrant farm workers is that they're always moving around. Okay, I'm going to be reading from my notes here as well. They're always moving around. So the idea of their health chart going from one place to another is not necessarily going to happen. Plus, there may be a language barrier. Okay, they may be afraid to seek care because they don't know how to communicate what is going on. Okay, so their frequent relocation creates challenges for continuity of care. Okay, they're much less likely to seek basic preventative care, standard annual checkups. Okay, so they're putting themselves at great risk for when they finally do show up for care. They're usually at a more advanced stage. Okay. Um, Migrants typically are at much higher risk for things like diabetes, poor dental health, obesity, and depression. And then think about the migrant farm workers that bring their families along. So there's a lot of risks for kids of migrant farm workers. Kids of migrant farm workers are at higher risk for malnutrition, infectious disease, dental issues, inadequate immunization status, pesticide exposure, injuries, and disruption of school. Okay, due to their constant mobility. One of the things I want you to know about is one of the biggest risks that migrant farm workers have is exposure to pesticides. So you need to know the difference between an acute pesticide exposure and a chronic. Okay. Some of the symptoms of acute pesticide exposure include memory loss, difficulty concentrating, mood changes, abdominal pain, nausea, vomiting, diarrhea, skin rashes, eye irritation, headache, confusion, and then chronic, which means a long-term exposure to pesticides. Some of the things that you might see are birth defects, cancers, blood disorders, neurological problems, maybe reproductive issues, Parkinson's-like symptoms, issues with infertility, sterility, maybe some liver damage. So think about the difference between acute and chronic. So if you're working in a clinic in a rural area that has migrant farm workers, remember the pesticide exposure is their biggest risk, and know the difference between acute and chronic. Okay? So we've covered those three bullets for the migrant farm workers. Let's move to rural populations. Okay, we don't often think of rural populations when we're talking about community nursing. But remember, rural populations exist everywhere in the country. And community nurses are in those rural areas caring for these populations. So, what are some common characteristics of the population? How do they access healthcare? Pardon me, in rural communities? What are some of the barriers they face? What about healthcare insurance coverage for this population? One of the big challenges in the rural population is health literacy. Okay, how much do people understand about how to access healthcare, how to seek out resources in healthcare, how to understand what maybe conditions they have or chronic diseases they have, and how to care for themselves? And what are some types of healthcare services that are difficult to access in the rural areas? Okay, so what is a rural community? This is right in your module. Okay, so healthcare access in rural communities, right? Ideally, everybody, whether you live in a rural or urban area, we should be able to access services. Everybody, we should be able to access services such as primary care, dental care, behavioral health, emergency care, public health services. Everybody, should be able to access all of these services for these reasons, for overall physical, social, mental health, okay, disease prevention, detection, diagnosis, treatment of illness, for quality of life, avoiding preventable deaths and life expectancy. However, rural residents encounter barriers to healthcare. Okay, this limits their ability to obtain the care they need. Okay, in order for rural residents to have sufficient access to have necessary and appropriate healthcare services, right, these must be available for them. And there's a lot of barriers to that. Okay, here are some barriers for the rural population. Do they have the financial means to pay for the services or the health services, dental services? Do they have the means to get where they need to go? Transportation is a big issue in rural communities. Okay, the locations of where they have to go may be great distances away. All right, do they have the ability to take paid time off to go to these appointments? A lot of jobs with the migrant farm workers and the rural community don't come with healthcare benefits, dental benefits, paid vacation, retirement. So these are hourly paid or daily paid. So they're going to be less reluctant to have to take the day off and travel long distances to seek care. Okay, remember in the rural community, you're most likely going to have very, very limited healthcare resources. Maybe a primary care doctor, maybe a family physician. You're not going to have all the specialists, right? If you need neurology or orthopedics or high risk OB or pediatrics, you're going to be traveling distances. Those services aren't all located in the rural communities. Okay. The other barrier for rural populations is their confidence in the ability to communicate what's going on. There's a lot of non-English speaking uh, clients, populations in the rural communities. So they lack the confidence to be able to communicate what's going on. The other barrier is trusting in the healthcare professionals they do have in the rural community, that their issues, their diagnoses, their health records are private. Okay. Other barriers, well, we talked about transportation, health literacy, and then there's also always a stigma associated with rural communities, the stigma of mental health issues, substance abuse issues. Okay. And then please review in your readings a little bit more in detail about these barriers, the transportation. There's always workforce shortages in the rural community. It's hard to recruit for the rural community. And then your readings give you a lot of different maps, which are quite interesting about the shortages in healthcare professionals. It gives you a graph of the shortages in the areas of primary care, which is pretty incredible. The other issue is health insurance coverage. Okay, we're in the section of barriers. So health insurance coverage is a barrier. Internet access is also a barrier, right? So the ability of them to do online meetings with doctors from far away or telehealth. Okay, it's a bit challenging in the rural communities. It's getting better, but it is a bit challenging. We talked about poor health literacy. They just don't understand what's going on, how serious their disease is or their new diagnosis is. Privacy issues. So read through these. We've already talked about these, but I want you to read through these in detail. Okay. Why is primary care access important for rural residents? Okay, we often see in the rural areas a very high incidence of chronic diseases. Rural populations don't focus, they're not focused on primary care. Okay, they're not focused on preventative services, including early detection. Okay, there's a very high incidence of chronic disease. What types of healthcare services are frequently difficult? We've touched upon this a little bit. Home health. Okay, there's always issues with travel, right? Do home health nurses from the urban areas want to travel into the rural communities? Okay, workforce, getting people hired and coming out to the communities, right? Time and resources required to serve patients located long distances away. Referrals are difficult in the rural community. Other services that are difficult to access in the rural communities are hospice and palliative care. Workforce shortages, finding people that want to travel those distances, recruitment, retention. Mental health services are also very difficult to access in the rural communities. Okay. Often the only physician in the rural community may be treating everybody, say pediatrics, they may be treating kids, maybe treating the elderly, maybe treating patients with cancer, maybe treating patients with mental health, substance abuse. There's very limited health resources. Here's another interesting map about the shortages of mental health in these rural areas. And then the lack of resources for substance abuse disorders, right? Despite the growing need for these kind of services, there's definitely a lack of these services offered in rural communities across America. Okay, from rehabilitation centers to detox centers, there's just very limited resources. People have to travel distances to get their treatment. And then the other services that are difficult to access are OB, maternal health services. Okay, if you have a high risk pregnancy, you're going to need to travel to get the specialty services. Oral health services, dental services, these are very limited in the rural communities. And traditionally, if they do have health plans, the dental part isn't covered. And then the rest of the reading is about, well, this part's about how do rural healthcare facilities and service closures impact access, right? There's multiple factors that can affect the severity and impact of the hospital or healthcare facility closing, right? They have to travel further, right? They're going to have decreased availability for alternative services. Transportation services is still an issue, right? If they're living in poverty or have other socioeconomic issues, it's going to be more difficult to access those services at a distance away. Some of the statistics about rural communities, they tend to have a higher proportion of age groups under 18 and the elderly over 65. They also have fewer years of formal education and fewer college degrees. It's estimated that a quarter, 25% of people that live in rural America live in poverty. It's also estimated that 40% of kids live in poverty in the rural areas. We talked about fewer residents having insurance or adequate insurance if there's not expanded Medicaid eligibility. Rural adults less likely to prioritize their health care or engage in preventative activities, right? They're more likely to smoke, drink alcohol. Obesity is an issue, less likely to participate in screenings and wellness visits. We already talked about much more likely to have chronic illnesses. We talked about the issues of increased mental health issues. Rural residents have higher rates of persistent depression and are at risk for stress-related conditions, especially if you add poverty into that. The high-risk rural areas have 4 primary high-risk industries: forestry, mining, marine-related fields, and agriculture. So these particular industries have high rates or high risk for health risks due to using heavy machinery, maybe accidents driving this machinery. They're at higher risk for trauma, cancer, allergies, respiratory conditions. Okay, so there's a lot of issues that are facing rural America. And this reading is an excellent summary. I want you to read through this section of efforts to improve the workforce. Lots of great things are being done to improve healthcare access in the rural communities, from telehealth. That's really a big push. Okay. Veterans, there's a section about what can be done to help veterans that live in the rural community. How do they access healthcare? And this is a great list of organizations who are trying to improve rural healthcare access. So this is a really good reading page. Homelessness. This week and next week is all about our special vulnerable populations. And we think about homelessness. What do we think about? How do we care for the homelessness in our initial approach? How do we establish relationships with people who are homeless? Who is affected? Risk factors, common clinical and medical conditions with the homeless. We'll see a lot of cardiovascular disease, dual diagnosis, meaning they have more than one issue going on. They may have a mental health issue with a substance abuse issue. A lot of cognitive disorders and TBIs. Homelessness, a big increase in injuries and violence if you're living in the homeless community. Homeless clients are not focused on preventative health issues. Okay, they're not interested in primary care. They're just trying to survive. Higher risk for infectious diseases and sexually transmitted infections. Skin and foot problems from the environments they're living in. Exposure-related conditions. Resources for homelessness. Okay, that is in your module reading. Okay. So let's go back to our module. This is also an excellent reading page, right? What do we know about the homeless? Okay, we know it can affect anyone, men, women, children of all races and ethnicities. It's estimated that on any given night, more than 600,000 people are in the United States are homeless. And more than a third of these are families. Right? We know that homeless people are more likely to become ill, have greater hospitalization rates, more likely to die at a younger age than the general population. This is quite a statistic. The average lifespan for a homeless person is between 42 and 52 years old. We know that homeless kids are much, much sicker, have more academic and behavioral problems. We know that often they lack the insufficient income, or they're living in poverty. They can't pay for affordable housing, that's one of the major reasons for homelessness. We know that homeless people suffer from complex advanced medical issues, psychiatric issues, and that may be exacerbated by the drug and alcohol use, right, in combination with living in poverty. Right, so when we're caring for the homeless, it needs to be an integrated, multidisciplinary approach with numerous healthcare team members, right, that are doing outreach. Right, these are typically involved with your local and state agencies. Okay. Homeless people, they're individuals without permanent housing who may live on the streets. They may stay in a shelter, a mission, single room facility. They may be staying in an abandoned building. They may be living in their cars. Right? Also, people are considered homeless even if they're staying with friends and family. Right? It's basically if they don't have a permanent address to go to. You can read about the demographics of homeless. It's all over the place. Okay. men, women, children of all races, ethnicities. Risk factors. What are some risk factors for the homeless person? Chronic illnesses with substance abuse or mental illness appear to increase the risk of early death. Right? Homeless people are 3 to 6 times more likely to become ill. We know that homelessness has very negative impacts on children. Okay, infants born into homelessness, low birth weight, 9 times more likely to die within the first 12 months. Homeless kids are sick at almost 4 times the rate of kids who are not homeless. They have increased risks of asthma, iron deficiency, lead poisoning, respiratory infections, ear infections, GI issues, and certainly emotional and behavioral problems. Right? These kids are also at a very high risk for demonstrating delayed development, very high risk of learning disabilities. These kids are much more likely to experience hunger, abuse, neglect, separation from family, poor nutrition. So what do we do? What's our initial approach? We must have empathy. Okay, during our initial approach with working with homeless people or homeless families. Okay, portraying genuine interest in their situation, empathy, respect, non-judgmental, non-threatening. Okay, our goal is to first address the symptoms. Okay, doing a history. Think of your nursing process, doing a history, right? You need to establish some kind of a relationship with this population or the client you're working with or the family you're working with, right? A trusting relationship that will give them the confidence to reach out for what they need. Okay, once you establish your trust and rapport, then you can start to focus on what are the issues going on, what do they need, what resources do they need, did the kids need immunizations, what are their resources? But they're much less likely to start to verbalize and communicate all of that unless you've developed some kind of an initial trust. Okay. Some of the issues that are face our common issues that face our homeless population: cardiovascular disease, dual diagnosis, mental health, maybe mental illness and substance abuse, cognitive disorders, maybe a traumatic brain injury, injuries and violence. This is a great table on special considerations with regards to healthcare for homeless people. Talks about logistical considerations, clinical considerations. Really good chart. Please have a read it. Please read that. Here's another chart that's excellent. Special considerations for medication use. We know that homeless populations often suffer from skin and foot problems. And you can read through this section. Maybe they have lice, scabies, bacterial infections due to their poor living conditions. They're also at high risk for exposure-related conditions. Cold, heat related injuries are common. They're living outside in the winter times. High risk for frostbite, hypothermia. Okay. And then this reading discusses the model for provision of care. So the best model of care, as we said, is an integrated, multidisciplinary approach by a team of healthcare people who understand the homeless population, who understand the unique challenges faced by this particular population. Trying to utilize patient-centered care. And here's a table on the resources, lots and lots of resources for the homeless population. The last concept to cover is poverty. The last two slides in your PowerPoint address poverty. Poverty and well-being historical perspective. What's the definition of poverty? What are some contributing factors? What's the geography around the country of poverty? Health issues common to living in poverty. What are the effects on poverty for young kids, adolescents, and teens? What can we do as nurses when caring for the population? So if you go to your reading, it addresses all of this. The top part of this gives lots of statistics on the historical perspective of poverty. So poverty over time. So have a look at that. I want to get into demographics. Okay. Poverty rates by selected race, ethnicity in a metro, non-metro residents. These from 2019, but they're pretty significant. Look at these percentages of families, people living in poverty as you break them down by race and ethnicity. And then same with poverty rates by family type. Look over here. The difference between a female head of the household, male head of the household, and then all family types. Pretty significant discrepancies. And poverty by age. Again, just have a look at these. How do we define poverty? Okay. Here in our country, poverty is officially defined as having an income below a federally determined poverty threshold. Okay. Any family or any individual with a total income less than the amount deemed to be sufficient for the essential goods, purchasing food, shelter, clothing, and other essential goods is classified as poor. Okay, and then this paragraph goes through some of the statistics of what are some of the historical numbers of what the poverty line is. Before COVID, here's some statistics for you. Before COVID, the percentage of Americans living in poverty was at the lowest that it had been since 1959, at about 10.5%. After the COVID, the poverty incidence of poverty climbed to 17.3%, right? And that translated into more than 48 million Americans. And the child poverty rate after the COVID was about 21.4, which is about 5 million kids. One of the things about the qualifications for poverty right? So even if you are living in below the poverty line, you have access to many, many resources. Once you rise above that number, those resources become very, very limited. And that's difficult because there are some people that live just over the poverty line that all of a sudden have all these resources that they're not available to them anymore. Okay? What are some contributing factors to poverty? Maybe unemployment, um, contributing factors to poverty, unemployment, loss of retirement benefits when, say, a company closes or files for bankruptcy and employees lose their retirement fund. Um, what does poverty lead to? Chronic stress, mental health issues, high rate of chronic illness, maybe higher infant morbidity and mortality, shorter life expectancy, much more complex health problems, more significant disability related to the chronic illnesses, maybe higher rates of hospitalization. Poverty affects so many things. And one of the best ways to assess the health of a family is their financial stability. If a family is financially stable, they're much lower risk of adverse health or adverse outcomes. When a family is living in poverty, it affects everything from healthcare access to education, nutrition. It affects every part of the family. Young kids are at the highest risk of effects from poverty. Lack of nutrition, poor brain development, exposure to environmental toxins, trauma, abuse, maybe lower quality daycare. These kids have more chronic diseases, more nutritional deficiencies, more growth restriction and developmental delays, higher incidence of maybe elevated blood levels, more infections, and they're usually stuck in this poverty cycle. Okay, due to the decreased opportunities in educations. If you talk about teens that live in poverty, they typically have below average academic skills, 3 times more likely to drop out of school, much higher rates of teen pregnancy, and much more likely to suffer complications during a pregnancy, whether it's lack of prenatal care, much higher risk for low birth weight babies, premature babies, maybe babies with birth defects. So a lot of risks. Okay, so that concludes your overview. Okay, your overview of week 3 content. You'll have a quiz this week, and it will just be on this content. Please make sure to do your readings that we just went through, kind of briefly went through. Have a look at your PowerPoint, and your quiz will be on these 4 concepts. Okay, thank you.